My name's Tara Montgomery, and I am the founder of Civic Health Partners, a consulting practice that helps healthcare organizations think about trust. I used to lead health at Consumer Reports, and there I worked with the ABIM Foundation on the launch of Choosing Wisely. And I've continued to work with the foundation over the past 10 years, and now I'm happy to be in the patient advisory group for the ABIM Foundation's Building Trust initiative. My experience of trust in healthcare really begins 20 years ago when I came to the US from London and joined a new employer who asked me to sign up for an insurance plan and tell them which primary health provider to choose. And I thought, no, I won't do this. I don't trust my employer to know anything about my health situation. And I said I did not want the insurance. And the HR guy thankfully signed me up for an insurance plan anyway. And so I went to the doctor and had my first appointment. And then I got what I thought was a surprise bill. I didn't know about copays and deductibles and so on. And I got really scared that I didn't trust who was going to ask me for money or what was going to happen. I wasn't familiar with a system where money seems so entangled with access to healthcare. When Consumer Reports became a partner of the ABIM Foundation at the launch of Choosing Wisely, I learned a lot about trust as a barrier and facilitator to success. Trust in evidence, trust in messages, trust in messengers, and our decades-long relationship with our members and the wider public helped earn trust in the Choosing Wisely message. But to be honest, there were communities that still distrusted our brand and our message. I think it's taken years for us to have the humility to understand that people of color have reason not to trust in the healthcare system and even to not trust in the mainstream media. They have experienced underuse of health services and not just overuse. So we've learned a lot of lessons about equity and structural racism, but I think we need to put into our work going forward and to understand that trust is local, it's personal, it's given and not just asked for, and it needs to be targeted and segmented and inclusive. So over the past 10 years since Choosing Wisely was conceived, the world has changed. Technology, populism, the democratization of information, trust has eroded across Western democracies, institutions, government, science, experts. And it's so complicated to make sense of the crisis of trust, to think about how we can change attitudes and beliefs and behaviors and not just ask for trust, but learn to be trustworthy. Since COVID reached us, we've all been trying to understand the impact of trust in people, in information, in systems, and what it's taught us that might be relevant to how we think about trust in healthcare going forward. What can help build trust between citizens, health professionals, and the system overall? How have failures in the response to COVID undermined trust? How have historic failures undermined trust? How have instances of heroism during COVID helped build it? And how can we finally tackle equity and systemic racism as part of our work to build trust? As part of my research, I spoke with 24 experts, leaders, writers, and activists about trust. They described many practices health leaders can begin to adopt to earn trust, the primary ones being to show competence, empathy, and transparency. But what stood out for me were the insights around trust, not just as a set of behaviors, but as a systemic challenge and a deeply personal one. To repair and create trust, citizens, political leaders, and healthcare leaders need to engage with the bigger issues of cultural division and social cohesion, racial, economic, and environmental injustice, and take radical steps to design a just society. That is the foundation of trust. And then at the individual level, we need to have the courage to trust each other, to trust the experts, to trust the scientific process. So I'm grateful that the Trust Initiative is creating space for that, for us to reflect together on trust and to learn to trust in ourselves. I'm looking forward to being a part of this learning journey alongside the physicians, the other patient advocates, and anyone who wants to help build trust in healthcare.
Visit buildingtrust.org to learn more.